Well, despite there being more cases and deaths reported across the state, Governor Cuomo today said the number of hospital admissions is starting to take a positive turn. Let's take a deeper dive now and bring in Dr. Stephen Thomas from Upstate University Hospital. Good to see you again, Doctor. Thank you so much for taking time out for us.
Hi, thanks for having me.
All right, let's take a look at the most recent data and trends. Where are we at in Central New York? Are we finally flattening the curve?
Right. So as was mentioned, we've had 442 confirmed cases thus far. We're averaging about 15 to 20 new cases per day. And so what that means is that the curve is still what we call a linear. It's still kind of a straight line going, gradually going up. I don't see any signs yet of a flattening per se, but I'm also not seeing signs of what we would be really concerned about, which would be an exponential growth or sort of that bended curve.
Okay. Well, thank you for that. You know, we've got the holidays coming up. Families might be thinking, well, you know, maybe it's okay. We can relax a little bit on the physical distancing. Just going to have a few people over. We do it every year. What would you like to say to anybody who's thinking that?
You know, it's been a couple weeks. I can understand that people might be getting fatigued and people might be feeling a little bit disconnected, but I would really urge people to remain resilient and to continue to follow what the county executive and the mayor are asking us to do, which is to have a very strict interpretation of the physical distancing policies. What can happen is, because we know that the way this disease is transmitted,
Did we lose the audio there? I want to apologize. Oh, I think he's
back. I'm back. I was watching the Syracuse Health Center downtown screening people, but I'm back now.
I understand. All right, so I'm just going to rewind a little bit because you got cut off. Let people know what is going to happen if we relax the rules on the social distancing, the physical distancing, I like to call it.
Right. Okay. So if we relax physical distancing, what can happen is that you can continue to have infected people mixing with uninfected people. You can cause new clusters of virus transmission, new people getting infected, which of course could result in people becoming ill, people being admitted to the hospital, and unfortunately people potentially dying. So it really is important that folks stay resilient, they stay focused, they stay connected through means other than being in the same physical space with one another.
Yeah, I don't think you can emphasize that enough, because again, there might be that feeling out there, well, it's been a few weeks, I've been good, I've been following all the rules. What's the harm in it, right?
Right. Well, we know what the harm is, because if you can look at the 1918 influenza pandemic, and there were many states that got out of the gate very fast, and they did all the right public health interventions, and they had very small curves, small case curves initially, and then they relaxed, and the rebound that occurred was much worse than the first wave. And so, you know, this is so we have history telling us what can potentially happen.
Right, we need to pay attention to history. Also, if I could tap into your expertise now, COVID-19 seems so puzzling, because you know, we see some people who get it showing no symptoms at all, then others getting very sick, showing the real dichotomy of this disease. What have you learned so far about COVID-19?
So you covered some of it, which is that we do know that anyone of any age can be infected. We know that younger people, children primarily, tend to do better than adults. We know that adults who are older in age have a higher case fatality rate than people who are younger. But we know that people who are younger who have comorbidities, so kidney disease, lung disease, diabetes, heart disease, young people can also do poorly with COVID if they have these pre-existing diseases. We're starting to try to understand how the virus actually infects the cells in the body, and we're trying to understand what are some of the things that could impact that. Is there some kind of genetic predisposition? Is it people who have COPD, for example, that the virus has a higher likelihood of infecting them in a greater way. So there still is a lot that's not known, but we are learning more and more every week, and we're trying to continue to learn more.
Yeah, we all are, and we're in this together. As we said, and we appreciate your expertise. We're so fortunate to have you in our community. Dr. Stephen Thomas, please keep us informed, and we appreciate you. Thank you for being here tonight.
Thank you very much.